and I want to welcome you to episode 152 of the Crisis Jam, 988 Crisis Jam. I'm Dr. Brian Sims. I'm Senior Medical Advisor with NASHBIT, and I am thrilled to be the host for today's presentation that is going to center around crisis services for Indigenous people. We'll move further to feature Colbie a little bit later on, but really the video before, I just want to remind people, please focus and see it in its entirety. It is incredulously powerful. Next slide, please. All righty, as we move through, just remember about talk.crisisnow.com. This is the area where you can find a number of information. For those that have not yet registered, please go into the registry spot so that we're able to give you the link each week so that you can make your connections. But also on the same page, you'll find videos and materials that can be immensely helpful. And you can even watch past crisis jams to get information. Next slide, please. All righty, and a reminder again that through this same site, you're able to pull up various videos from previous elements and as well see portions of what we've been doing. So it really helps to kind of catch you up to date if you haven't been able to be present on some of the crisis jams, but to also communicate with others about the wonderful work that's going on within this crisis jam format. Next slide. And this is a reminder again of the, we'll show here the top 5. And it still is highlighted with the youth edition with Dr. Anita Everett and Dr. Belina Shaw. But on the next slide, you'll see as we go to the 10 spots from number 6 through number 10, I just wanted to highlight that number 9 that is occupied as law enforcement coordination with Dr. Deb Pinels was actually at number 10 earlier. So it's moved up, which kind of gives us an indication that there is increased interest with regards to law enforcement coordination. So kudos to them. Next slide, please. And this is a reminder again that as of this point, we have nearly and probably at this point over 400 unique speakers over the 150 or 151 episodes that we've had thus far. Just phenomenal number of individuals. And as the next slide will show, we have a kind of an overview of all of those speakers as we're going. But we still want to remind you about what your ideas are as well in terms of crisis jam topics and speaking components. For those in the jam before, in the run of show, we did mention that, but you can see here that we have a host of individuals, and this is an incomplete list, which probably suggests that we have even more than 400. Next slide, please. Righty, and here's an article on NPR about cities know the way police respond to mental health crisis calls needs to change, but how? And again, it's that contemplative piece that we want to work on and ensure that we take a look at those particular components. How do we make those changes? And how do we work on moving that needle forward? Next slide. This is a reminder of our SAMHSA store where suicide and crisis lifeline elements are available. A reminder that you can get up to 326 materials for absolutely free. Please access this site to obtain the materials so we can get the word out about 988 and get it out to the communities. Next slide, please. And again, about our store for the jam session, for those that are involved in a crisis hot seat, this is something that you'll automatically get, but just a reminder for all those who would wish to purchase t-shirts or hats or other elements of 988, we have the link where you can go in and get those particular items. Next slide, please. And I want to move now to our crisis hot seat. And in our hot seat today, we have with us Brenda McFarland, who's a Crisis Now community coordinator in Fairbanks, Alaska. And we were talking about just how hot it is in Fairbanks at this point. So Brenda, thank you so much for taking time out to join us today. Now, as you see from the hot seat, we're going to do it just a tad bit different with you today. Okay. It's not anything to scare you. Otherwise, we're a very friendly bunch here. But I'm going to read the question here, and then we're going to kind of post a little video before we actually show you the question, if that's okay with you.
That's okay, as long as you don't make me dance. I see dance.
Okay, well, maybe the next time. But as it reads, Justin Shelby, director of Moving America's Soul on Suicide, just returned from filming a korobori, which is a dance ceremony that can take the form of a sacred ritual or an informal gathering. So just wanted at this point, before we actually pose the question, want to show you a little video clip that Justin actually filmed. Although the video did not have any words or anything attached to it, it wasn't intended to give you clues per se, but just he did a wonderful job in terms of doing this filming. So the question that we have for you, Brenda, is in this particular video, which culture did Justin experience in this video? And your choices are Native Hawaiians, the Indigenous people of Australia, the Maori of New Zealand, or the Plains Indigenous people of Canada. And you can either make the call on your own, or if you would like to wait and see how the audience responds, or you tell me which way you'd like to go. If you want to phone a friend, if you have someone who's online here that you'd like to help out, which way would you like to go with this?
Okay. I'll poll. I think I have two answers that I think are the most likely. And ones. So yeah, I'll go with the poll. I'm gonna bring Bobby Dorton here. He's here from Tanana on Chiefs Conference real quick.
Okay.
I'm on the screen.
Are you?
Come over. This is my colleague from Tanana Chiefs Conference, and I wanted the topic being Indigenous cultures. I wanted to make sure we were well represented. So
Hi.
Okay. And it's very nice to meet you, sir.
Yeah.
We were just asking the question here based on Justin Shelby, who's the director of Moving America's Soul, had just returned from filming a korobori, which is a dance ceremony that can take the place or take the form of a sacred ritual. So we were asking, based on this, which culture was he representing in the video? And if you did not see it, I apologize, but your four choices are Native Hawaiians, the Maori of New Zealand, Indigenous people of Australia, or Plains Indigenous people of Canada.
well, I know it's not Canada because we're similar enough to Canada. That is not our territory.
I haven't seen it.
So I'm
Okay.
gonna go with
Well, if I can help out,
Australia.
if we take a look at the audience, maybe that might be helpful to you. The audience, as you can see from the poll, favors Australia just by a tad, but you see coming in a fairly close second are the people of Canada, and then followed by New Zealand. So I don't know if that helps or not.
I think from that first beautiful shot, I was thinking Australia, so I'm gonna go with my instinct there.
All right, well, let's go ahead and reveal the answer, and you are absolutely correct. So in the Indigenous people of Australia. So that's where he had done his filming, and that's the clip that you actually did see. So thank you so much for that. We have a t-shirt or a hoodie or otherwise waiting for you. It didn't matter, Brenda, if you were in or out, you were obviously going to get a t-shirt. So thank you so much. And just if you are available, we could pull you in for just a moment to maybe give a short comment on this moving the world's soul on suicide. So just a really brief comment, sir.
Sure, yeah. Well, so this was the first thing that I've been able to film so far. Flew me out to Australia. as most people guessed correctly. And I was able to drive out with Joe Williams and his son, and get to experience this pretty incredible. I felt a little like an insider, like I almost wasn't supposed to be there. I was witnessing something so ancient and just genuinely special this whole time, and I had this kind of front row seat. But it was pretty incredible. I mean, a lot of their dances, Joe told me a lot of their stories, their people's stories, and a lot of their dances are just those stories in that physical medium. So getting to watch it play out through dance, and I don't know, it was pretty special, I think.
Well, Justin, thank you so much for those efforts. I imagine I would have wanted to have been in your luggage. Having an opportunity to do that, but it sounds spectacular. And thank you again for coming on and sharing that with us.
Sure.
All righty. And we're going to move on in our session. Here's a quote. There's no magic wand, there's no deadline, and there's no right way to do it. Find the things that resonate in your soul and do these as often as you can. Believe that you deserve a full and happy life and that you're worth the time and effort. And this comes from our own Shelby Rowe, and we'll be hearing from her a little bit later on. Thank you, Shelby. Next slide, please. And we are now ready for our feature presentation for today, the Crisis Services Map for Indigenous People. And we are honored to have with us Colbie Caughlan. And Colbie, I'm going to apologize up front because I looked at that last name and I was really struggling with Caughlan versus Caughlan.
You had it right the first time, Caughlan.
All right, perfect. Well, Colbie is the project director for Thrive, the Suicide Prevention Project, and the Tribal Opioid Response Grants at the Northwest Portland Area Indian Health Board. And she provides suicide and substance use disorder prevention, technical assistance, programming, and training to the Northwest tribes. She is a master trainer of the Question, Persuade, Refer, and Applied Suicide Intervention Skills Training, which is suicide gatekeeping training. So Colbie, without further ado, I pass it over to you. And thank you for joining us.
Absolutely. Thank you so much for having me. Today is one of my days that I work from home, so I apologize if you hear a dog bark. Hopefully we'll have no UPS or Amazon deliveries today. It's so wonderful to be here. I really appreciate the invitation to present today and can't wait for all of you to see the new crisis services map at the Northwest Portland Area Indian Health Board. So we serve the 43 tribes in Washington, Oregon, and Idaho, and we work hard to assist Northwest tribes to improve the health status and quality of life of member tribes and Indian people in their delivery of culturally appropriate and holistic health care. This map here, you'll see the 43 federally recognized tribes that our organization serves. We are based out of Portland, Oregon. So there's our logo right between Washington and Oregon, and that's where Portland is, just close to the border near the Columbia River. And we, again, serve this whole region. We try to visit our tribes as often as possible. And we have a strategic plan that really guides us on our work. So we ask our, what I like to call our 43 bosses, the delegates from the tribe, we ask them what they want us to work on. And we usually have a plan for about a 5 to 10 year span. And suicide prevention and substance use disorders have really been high on that list for many, many years. I've been at the health board for 14 years, and it's just been an honor to serve the tribes in our area. Next slide, please. So Thrive, again, is the suicide prevention project at the health board. It stands for Tribal Health, Reaching Out Involves Everyone. And our mission is to reduce suicide rates among American Indian, Alaska Native peoples living in the Pacific Northwest by increasing tribal capacity to prevent suicide and by improving regional collaborations. So we work really closely with the 43 tribes in our region, but we also have lots of friends and colleagues all across Indian country that are also trying to reduce suicide rates throughout the entire country. We have 4 goals that we work towards on a pretty regular basis here. So we want to improve tribal suicide prevention policies and environments. through coordination, collaboration, and resource sharing across tribes, departments, and programs. And one of the things that you'll see today is the crisis services map, which really helps go towards this goal of improving the policies environments that folks utilize across their own tribal programs. We really try to make it easy for the tribes in the Pacific Northwest to get what they need to have the biggest and awesomest and most amazing suicide prevention projects and programs that they can have in their communities. We want to enhance organizational systems and practices, so we help with the zero suicide model with some of our tribes. We want to promote healthy family and community norms, and we want to improve knowledge and attitudes and behaviors, not actually only among American Indian Alaska Native youth, but also with adults, veterans, and the Two-Spirit LGBT plus population as well. We develop a lot of trainings, or we actually don't develop the trainings, we do the trainings, and we help develop media materials, including those for 988 and the crisis text line. And I want to show you now some of the collaborations or how we go about our collaboration. So next slide, please. Okay. I'm looking at two screens, so I have my notes too. We really try to communicate with so many people. We talk with the Indian Health Service, the Bureau of Indian Affairs. We talk to youth groups with Unity, the We Are Native Youth Ambassadors. And We Are Native is something that's housed at the Northwest Portland Area Indian Health Board and is actually a website for Native youth by Native youth. I have a colleague on today. Her name is Aurora. So sometimes you'll hear me talk to Aurora. So Aurora, if you could please drop in the We Are Native website into the chat, that would be amazing. We also connect with the tribes, again, in the Pacific Northwest and ask them, what do you think youth need when they are thinking about suicide, or when maybe they have a friend that has expressed suicidality to them? And many times people say, well, we need to know where is a trusted source we can go to. Who can we talk to? And how do I talk to my own friend when they're thinking about suicide? And then we also talk to adults and ask the same sorts of questions. And on a National Action Alliance for Suicide Prevention call that we have about twice a month, the American Indian Alaska Native Task Force talked about how can we create something where people can go online and find crisis services without just Googling them, because sometimes you come up with services that maybe the number is incorrect, or on the website, it doesn't actually tell them if it is crisis stabilization, is it a 24/7 call-in line? And folks don't always know what to do or where to go. So if there's a youth that wants to talk to their friend about suicide and they want to give them a resource, or an adult too, to be honest, we thought that creating some sort of crisis services list would be really great. Next slide, please. Although a list is not super easy to manage all the time, and you don't know if it's in your area. And so we thought maybe we should do a map. I'm going to get to that real quick. Another partnership we have is the Crisis Text Line Partnership. So we actually started a short code, and that would be text native or text indigenous to 741-741, and people will get connected to free 24/7 support. And I know that's for the crisis text line. This partnership started before 988 was launched last year. And I know you can text into 988 as well as call. So please, obviously, all of you know to tell your friends and family about the 988 line, and even the crisis text line if that's something that works for them. And we are able to look at a dashboard and find this list of information of what people are texting in about. When we have tribes in a certain area say, hey, we would like some data about how we should program around suicide prevention, around other difficult topics, we might send them the list of what people called in or texted in to the crisis text line about, and use their area codes. So if we put in maybe the 425 area code, that's King County. There's a lot of tribes that are around that area, but we could send them something and they might know that multiple people are texting in about depression, or maybe they're texting in about financial loss. And then the tribes can help program to meet that need of something that people are struggling with at the time. Next slide. And back to the map. So we thought that creating a crisis services map would be another really great way to engage with people that are looking for services. So yes, 988 is a great resource. Yes, the crisis text line is a great resource, but sometimes folks are ready to maybe have an appointment or call directly to a crisis line that's connected to a tribal clinic or to a county clinic that serves American Indian, Alaska Native people. So this is the crisis services map. Aurora dropped in the link also, so it's clickable for you. I know on the PowerPoint, you won't be able to click it here. This map took about 8 months of research to gather all of the information that we could about crisis services available through each IHS region. If you'll notice, we put the coloring as close to suicide prevention as we could. We wanted the teals and the purples to really connect with people and have you know that, you know, we're trying to combat suicide here. And so keeping with the colors of suicide prevention is something that we wanted to do. So crisis intervention services respond to those experiencing distress or anxiety that results from mental health and substance use disorder. One of the main goals of crisis intervention services is to prevent people, including those from Indigenous communities, from needing more restrictive care, such as psychiatric hospitalization or emergency detention. And this is something that we also put that little blurb on the website with the map so people know hopefully what they're looking for here and what we're going to connect them to. We don't have the map up, obviously, from the website, so I'm just gonna talk you through how it works. So if you go to that link, you'll get a little bit of information about the crisis services map and how it started with conversations between a group of folks on the American Indian Alaska Native Task Force, as well as being requested by the Indian Health Service to create such a map. So when you click on a region, so say you want to learn about things in this Aberdeen IHS service region, you can click anywhere in that light teal blue color. And I do request that you wait up to 5 seconds because there's a lot of information being filtered. And so it does take the map a little bit to move to the next step. So if you were to click on this region and then the next slide, what will happen is it'll zoom closer to that Aberdeen area region. And then what you'll be able to do is click a specific state, and then you can search based on crisis services that you're looking for. So you'll be able to click get help 24/7, mental health crisis, mobile crisis outreach. I apologize if it's a little bit blurry. The screenshots were difficult to do on my computer. And you can click through, wait up to 5 seconds, and then you'll see more lists to the right. Sometimes there's not very many, I'm going to be honest. And what we also hope for is that people can see that there's not very many, and maybe some tribes and some counties would be willing to try to open up more services that will assist with American Indian, Alaska Native people. So right here in the Aberdeen area in South Dakota, without clicking any of the filters, there's the Avera Behavioral Health Hospital, and there's a little circle here, and that actually says 24. If you can't see what it says 24, which means that 1-800 number is 24 hours a day. So we tried to have little icons that let you know how often and what specifically you'll get connected to. And then there's also a connection with the Lower Brule Sioux tribe and the Rosebud Sioux tribe suicide and crisis support line. So you'll see that you can call 988 or text 988. So that means that on the Rosebud Sioux tribe suicide and crisis support line on their website, they actually use 988 as their 24/7 call or text number. They do have another phone number, but it's most likely that it's not open 24/7 if it doesn't have that 24 on it. Here it says you can text home to 741-741. And that could be that the Sioux tribe wants to connect their data to that text home. Or you can still text native or text indigenous to 741-741. Okay, and then if you were to click under the crisis services, there's a reset button also, and then it'll get you back to the map. And if we can go to the next slide, please. If you were to click youth hotline and services on the left-hand side, and maybe you had already reset it, so you're not in any specific IHS region and you're not in any specific state, it will list all across the country youth hotlines and services that also serve American Indian Alaska Native youth. So we have Boys Town National Hotline, and it shows that 24/7. Burrell Behavioral Health Crisis Line, California Parent and Youth Helpline, California Youth Crisis Line, etc. Comanche Nation Residential Youth Shelter, and more things as well. So there is the feature that you can click on a phone number if you're on your cell phone, and it will call directly. You can also click if you have some sort of software on your computer that will call out. You can click on those phone numbers and your computer will call out if you have that software. I don't have it, so I don't know how it works, but I can use it on my cell phone. You can click on the title of each category listed or of each crisis service listed. If you want to look further into what that maybe the Comanche Nation Residential Youth Shelter, what really they have to offer, click on the title, and then you'll be able to read about it from their specific website. Many of the services you will find in this interactive map just scratch the surface of what each organization may be able to provide. So definitely looking around, clicking different things and checking what each organization in your area has to provide is a really great thing. So you're equipped with more resources if people come to you. If you ever find that something is incorrect or has been updated, so maybe a phone number has changed and you happen to know because you work there, or you've called the line recently and it says that it has changed, please feel free to contact us. Next slide, please. So this next slide is showing how many crisis services we could find in each state and IHS region. So it can really be helpful, like I said before, to expand care services to include crisis services. If you're in a specific area that maybe only has one or two that specifically have crisis services for Indigenous peoples. There are parts of the country that are increasing their services, and hopefully in the next 2 years, 3 years, we'll see more, especially with the new 988 grants that have gone out. There's been tribal 988 response grants that have been awarded in the past few months, in addition to maybe 15 or 17 being awarded last September. So we're really hoping to see in the next couple of years some of these numbers increase for crisis services across Indian country. They're definitely needed, and I think they would be very much welcome for people that are starting to call in and trust 988 and trust the crisis text line and trust their tribal crisis lines if they do have one, which is really awesome if that's the case. For changes to the website, thank you for prompting that. Next slide, please. There is a section at the bottom of the crisis services map page, and you just scroll all the way to the bottom and it says, get in touch with us. So this crisis services map is going to be a living document on the website. So any entity that wants to change any of the information based on, obviously you guys are the experts and the folks that work at these clinics are the experts. We're hoping to gather information that comes through this section of the website. So you'll put your email and then you just message us with what the changes would need to be. So give us the title of the organization or the company, and then what has changed. We hope to take all of those and update this map maybe once a quarter, depending on how many things that we receive that need to be changed. If there's a ton of them in 1 month, then we will absolutely capture those and go put those in and make those changes. It's not super difficult to do so. We just want to do it in a way that really makes sense. We always have a disclaimer that states if someone you know is having a medical emergency, please dial 911. And if they're having a mental health or substance use emergency, to dial 988 or text 988 for the suicide and crisis line. We always put that pretty much everything we do anywhere we go, so that folks remember that although this is a resource, the quickest way to get assistance would be to call 988 for mental health and substance use emergencies. That's the most part of the map. I did want to tell you a couple more things. The Northwest Portland Area Indian Health Board created some 988 materials. I believe I said that before, for the Suicide and Crisis Lifeline. We were asked by the Indian Health Services Division of Behavioral Health to create these leading up to the launch of 988. So we had a big coming soon. Don't forget this number, that's 988. I don't know if some of you, wherever you live, there's a commercial that constantly is in your brain. In the Pacific Northwest, there's a jewelry company called the Shane Company. And what I really wanted to do was mirror them, where when you're thinking about buying, I don't know, a piece of jewelry or a ring or a necklace, it's go to the Shane Company on 4th and Stewart in downtown Seattle. And it reminds me of that. And that's what I want people to know about 988 is, oh my gosh, I am anxious right now. I have these thoughts of suicide, or my friend is thinking about suicide and keeps telling me about it. And instead of having to go search for what to do, they say, oh, well, we call 988. It's the same thing. That's really what we want out there. And so we started to put the coming soon 988 materials out between April and July, early July of 2022. And then we launched the Dial 988 for mental health emergencies on about July 15th via social media, and then in print materials as well that we mailed out to over 300 tribal organizations and tribes last July as well. Next slide. We also have no cost mental health services paid for by our SAMHSA Tribal Opioid Response Grant. This is really amazing. So if there are providers that are thinking about suicide, but doesn't even have to be thinking about suicide, actually, they just want to connect with a counselor that they don't know because they're already in the behavioral health department. This is a great option. And the folks that are on this are from the Indigenous Living company, and they've worked with Native communities for a while, and they do have some Native counselors, and it's just been a great service for folks. Please utilize it. If there's a long wait list at your clinic, have patients start with this so that they can get in to somebody over the phone, maybe for 1 or 2 visits before they can get into your clinic. Next slide, please. And then this is just who we are. So again, I'm Colbie Caughlan. We also have a principal investigator, Dr. Stephanie Craig-Rushing, and the amazing Aurora Martinez, our Thrive Project coordinator, is on the line today. And I always have to plug our youth conference every year, Thrive 2024. It's at the Portland State University's Native American Student and Community Center in Portland next year, June 28th to 24th to the 28th. We love this. It's interactive, and it teaches youth to take challenging topics in their life and channel it in a really positive way for a positive product that is usually art-based or music-based. I really appreciate being here. Thank you so much. And if you have any questions, do not feel free. My apologies. Feel free to give me a call or email, and I will drop that in the chat. Thank you so much.
Well, Colbie, thank you for that wealth of information. It was just tremendously given, and you can see from the chat box the tremendously positive response that people are giving. I only apologize that we don't have a lot of time to give you more to be able to expand on it. And I'm going to ask at this time, and thank you again, Colbie. I'm going to ask if there are some brief comments, either from Aurora or Shelby or both of you, just on this presentation. And I guess we'll start with Aurora.
Hi, thank you for having me. When it comes to the work that we get to do between Colbie and I, it's really amazing to see. I did see in the comments that there was a question about like how to connect with tribes, and I think it's really important to just reach out with the tribes or find an organization through our crisis map that you can reach out and they'll be able to connect you. If there is an IHS serving area like us at the Northwest Portland Area Indian Health Board, we're always happy to be that connecting point and have a conversation with you about the appropriate ways to talk. So it just depends on the area in which you live, but we truly appreciate and enjoy the work that we get to do. And I love getting to serve the areas that I come from and the tribes that I come from. So thank you for allowing us to share the work that we get to do.
Aurora, thank you so much for that. I'm going to ask some quick comments from Shelby, please.
It is always a great day when I get to listen to Colbie and see all of the amazing work that Aurora and Colbie and the rest of the team at Portland Area Indian Health Board are working on. They really are, leading the nation in just innovative solutions on how do we make resources more accessible and how do we help tribal families and youth really connect with each other and connect with the services that they need. Happy to, Colbie mentioned a meeting, probably one of the most active task forces of the National Action Alliance for Suicide Prevention. Pamela Endofhorn, that is a friend of many of us, has been the chair of that for years. And we meet every other week. And the database that you saw came out of that. I know right now also coming out of that task force will be a new guidebook for helping crisis centers to connect with their tribes and learn. We at SPRC, we're working on some projects that came out of that group. So there's a lot of innovation, a lot of collaboration that is happening across Indian country when it comes to promoting crisis services and making sure that everyone has access to good suicide prevention and mental health resources. So thanks for giving me an excuse and opportunity here at CrisisCon to come back up to my room and hang out with Colbie for a little bit.
Right, and thank you, Shelby. And as always, thank you, Aurora. Thank you for all of the presentation. It absolutely was compelling. And we're really asking for people to take a look in the chat box, grab the linkages as you're able to, and we'll follow through with that. But moving forward now, we're going to go into our SAMHSA updates, and we're asking for Dr. John Palmieri if he'll come aboard and give us the SAMHSA latest updates. Thanks.
Thanks, Brian. Good to be here and appreciate Shelby being on the call as well. Just wanted to highlight another piece of amazing work that's come out of partnership with SPRC, Action Alliance, Ad Council, which is the formative research project around 988 implementation. This is something that we've been talking about for quite a while, but happy that we've gotten to a place where we have been able to share with the public the work that has been accomplished, and obviously more work to come, but also a toolkit that's been published as well that people can use to support some of the communications work that they're engaged in their communities. So just for those of you who are not aware of the conversations that have been going on in this space, the 988 Formative Research Project really was designed to fill a critical research gap and to support more informed 988 messaging and implementation efforts, recognizing that there was a need among groups, particularly those at higher risk for or disproportionately impacted by suicide, to develop messaging that's culturally sensitive, responsive, and effective. So the research project really was conducted to identify knowledge, attitudes, beliefs, perceptions about accessing crisis services among these populations, to identify some of the barriers to seeking help and some of the motivators also and facilitators for seeking help among these populations, to inform culturally sensitive, responsive, and effective messaging, and also to identify trusted messengers that people lean on when they're having a hard time. And so I mentioned that a lot of this work, there was a webinar sponsored in part through our new Training and Technical Assistance Center that happened on November 7th, and the publication of a toolkit, which again is really intended to support the needs of organizations that reach the public. So that includes everybody on this call and beyond, as they're designing messaging to build awareness of 988 and also to build trust in 988. So the toolkit provides insights that can be used by communicators to craft and test more effective and personalized messages among these populations. And there will be some companion work happening that's already underway around the trusted messenger piece and a toolkit that's more oriented toward working with trusted messengers, which we expect will be rolled out sometime in 2024. And I'm happy to provide a link in the chat where people can access more information about this great work. And then just two other quick flags related to the Training and Technical Assistance Center. As many of you have participated in the initial 988 911 webinar as part of a longer series on 988 911 coordination. There will be another part of that series that will be in December. Some more to come on that. And then the 988 office, through its Training and Technical Assistance Center, will be standing up monthly office hours that will be open to a range of audiences, really in part to hear from people about what some of the challenges and needs are where the government, where the federal government can be helpful, and also for us to be providing more information about what we're doing at the federal level and to sort of help refine clarity around the role of SAMHSA and of the office in supporting crisis services implementation. So more to come there. And I think that's enough for me for today, Brian. Thank you.
Well, thank you, John. And as usual, thank you so much for that information, but also the leadership and guidance that SAMHSA provides for us. It is overwhelmingly positive and we really love it. We will go down to the Nashville updates, and we have our Chief of Staff, Megan Haupt, to give us a brief update from Nashville.
Thank you so much, Brian. One of the things I just want to point out on this map, you'll see pictures in the different states, and on the Crisis Jam, those are the states that have had innovations highlighted, and the ones with the names in the states have not yet been highlighted. So if you're from those states that have the names in them, please let us know of any innovations that you would like to highlight from your state. One of the things that I really wanted to bring forth in these Nashville remarks is the National Dialogues and Behavioral Health Conference that occurred in New Orleans at the end of October and the beginning of November. And the National Dialogues, to put it in context, there's an executive committee that decides on a very a topic that's cutting edge, that if addressed could really potentially move the needle on that issue. So the whole conference addresses a particular theme. In this case, this year, the executive committee decided on responding to trauma and violence. Now, when I went into this conference, I thought, oh my goodness, this is really going to be stressful. This is a very intense topic. There are a lot of myths around violence, particularly that people with mental illness are the cause of violence. And of course, we know that's not true. And that the large majority of people with mental illness are not dangerous and are not violent to others. So what we wanted from this conference was, one, to dispel that myth. Going and attending the conference, I got so much more than that. And the dialogue and the comprehensive nature of addressing trauma and violence in all of the places that intervention is possible, whether it's early childhood, whether it's understanding that somebody who perpetrates domestic violence is a high risk for suicide, knowing the different ages or the communities, or somebody who may not have coping skills if they've lost a job or lost an important relationship. All of these pieces matter, and that the systems need to come together to address violence in a comprehensive way. And there are all types of different violence. So it was understanding that communities needed to be connected, that there's community interventions, public health interventions, and was really thrilled for the partnerships and the research that was presented. And SAMHSA presented there, NASHBIT staff presented as well. So it was a great conference, and I look forward to talking with anybody about it as we move forward. But the one thing I took away was there is not one thing that causes violence, and that how much we wish there was, so we could just contain it and control it. We really need a comprehensive approach. Thank you.
And thank you, Megan. And to everyone, Megan is very, very serious when she says connect with her, because she will respond. But thank you so much for all of that, Megan, and thanks for the ongoing efforts of NASHBIT. Let's move now to our data corner. And we have with us Jonathan Pirtle, the Associate Professor, Department of Public Health Policy and Management, who will give us a brief update. Thank you so much for joining us, Jonathan.
Thank you, Dr. Sims. Hello, everyone. Always an honor to be here on the Jam. So I'm going to present the results from a survey we did this summer about 988. The study was recently published in JAMA Network Open, which is an open access journal. So you can read all about it. So there have been a number of surveys already about 988. Q has done one, NAMI has done a few. Kind of the key distinction here is we used a questionnaire called the K6. The K6 is a psychometrically validated 6-item question that you can use to put people in different sorts of categories related to their past 30-day psychological distress. So we administered the K6, we took our sample of about 5,000 US adults, the survey was done in English and Spanish, and we put them in categories of serious psychological distress in the past 30 days, moderate or none, which doesn't mean 0, it means a score less than 11, in the past 30 days. And we looked at how responses to these 3 different questions related to 988 varied across these groups. So we asked folks if they had heard of 988. We defined 988 for them. And we said, you know, have you heard of it after we defined it? So just a dichotomous yes, no. We asked them whether or not they had used 988 on behalf of themselves and a loved one. Separate questions. Here we're just presenting on behalf of themselves. And again, the survey was fielded about 1 year after 988 went live. And we also asked them how likely they would be to use 988 in the future if they or a loved one were experiencing suicidality or a mental health crisis. So here what we present is very likely. So that's just dichotomized as 6 or 7 on this 7-point scale. I will say, and we also asked about how likely they'd be to reach out to a mental health professional, someone in their religious network, a friend or family member, or a crisis line other than 988, which we're going to present in a separate paper. So what did we find here? So we found, in terms of having heard of 988, we find that people in the serious distress category are significantly more likely to have heard of 988. So I take this as a good thing. We want to see that. Of course, we want to see more universal awareness across the board. We'd love to see this be 100% across all categories, but I think a positive signal. We see that the percentage of respondents having used 988 on behalf of themselves way higher among those in the serious distress category, 6% of the sample in that category, compared to moderate distress, 1%, and only 0.2% in this no distress category. And then finally, when we ask folks, how likely would you be to reach out to 988 if you or a loved one were experiencing suicidality or a mental health crisis, we see slightly smaller proportions in the higher distress categories. I'll say we see this across all the different sources that we asked about: mental health professional, friend or family member. This is not unique to 988. And as I said, we're working on those subsequent analyses and writing those up now. We did a logistic regression. Here we know we put into a model demographic characteristics, trying to isolate the effect of this psychological distress category on these variables. We see that the same story shakes out, right? So it's not just some demographic characteristics that is associated with psychological distress driving these associations. We see that the effect persists after we adjust. And lastly, I want to present a finding that I think should be interpreted with caution, but I think it's important and worth noting. So when we take our sample here of about 5,000 respondents, and then we limit it to just those with serious distress, which was about 8% of the sample, which is consistent with prior nationally representative surveys. And then we limit that to folks with serious distress and had used 988. Only about 30% of them said that they would be very likely to use 988 in the future if they or a loved one were experiencing suicidality or a mental health crisis. So of course, we have a small sample size here. We should interpret this with caution, but I do think this does raise questions about why this percentage isn't higher. Of course, we want to see it higher. These were folks that had a natural inclination to reach out to 988 in the past, and we'd like to see that higher. A smaller percentage, only about 15%, were on the other end of that scale. So 1 or 2 being very unlikely. So it's good, it skews towards being very likely. But I think it's an area that we're all interested in, thinking about how we make sure folks are satisfied with what they receive when they communicate with 988. I will drop the link to the study in the chat and feel free to reach out with any questions. Thank you for listening.
Well, Jonathan, thank you so much for that comprehensive overview. And that really is important information right at the right time. So thank you so much for that. And we would say to each of you, access that information. It can be incredulously helpful in terms of the movement that we're attempting to do. So thanks again, Jonathan. Now let's move now to our crisis talk for the day. And Stephanie, if you're on, you would come on board, please.
Hi, Dr. Sims. Thank
Hi
you.
there.
Unfortunately, Dr. Warrior could not be on today, so Shelby said she would join me, which I appreciate. I don't know if you're able to spot. Hi, Shelby. So it's been a while. This article was originally published on June 15th, but I think a lot of the points are still applicable. I think where there's probably been the largest amount of change is what's happened with 988 since the article ran actually the month before 988 went live. But one thing that Dr. Warrior mentioned, which I think Shelby is still relevant, is she spoke about the importance of engaging high school students who are part of tribal populations. And she said, for example, she ran free camps that focused on both psychology and culture. I think they got 3 college credits for that. And one of her quotes, she said, "We're trying to plant the seeds so that those from the community are serving the community." So I wanted to see both, some things that you'd like to mention, Shelby, about changes since then, innovations, but also your thoughts on what she was saying about planting seeds within the community.
I was having trouble getting my mute off. I think, a lot of, Dr. Warrior really shared a lot of good advice and wisdom in this article, and a lot of it still holds true.
Mhm.
it strikes me that, at the beginning, when Colbie was sharing with us the work of Thrive, they also put a big focus on youth, and also have a conference for young people. I think part of that is having those creativity to bring in healthy norms for the communities, and making sure that the young people feel connected to their culture, to their communities, and can help find their purpose, not only helps reduce risk for those young people, but also really helps to strengthen their communities. Since this time, SAMHSA has been able, they just awarded the second cohort of tribal expansion 988 grantees. And so really looking forward to seeing, I think right now, John may be in Oklahoma, a lot in Oklahoma right now, there is a tribal 988 summit that the tribes in the state, both those with 988 expansion grants and those without, are hosting a summit to talk about what are things that tribes need and how can 988 be better integrated into behavioral health care that serves their communities, their populations. Everyone, if you all haven't had Dr. Anitra Warrior speak, you're missing out. So maybe the Crisis Jam will have her back on at some point this year.
Yeah, that would be great. Thank you, Shelby. Thanks for joining me.
And thank you, Shelby, and thank you, Stephanie, for that overview. I would say as well that it would be wonderful, because I have heard Dr. Warrior, and it is such phenomenal. And when we think about 988 implementation, hopefully today what has happened is that we've raised awareness of the work that still needs to be done to ensure that we have adequate presentation of 988 to all cultures and to all elements, and we can learn so much from this. We use Alaska so much as an example in our discussions with the states. So I would say to you all, check the chat box out as well. Additionally, add any comments or any questions that you might have in there. Because of the brevity of time, I apologize for not being able to really specifically respond, but clearly add your questions in there as they come through, because this is a highly interesting topic and a necessary topic to discuss at this time. So let's go to the next slide. And I just want to point out, going forward, there will be Crisis Jam debate #2, and it's scheduled for January the 24th of 2024. So put that on your calendars, folks. This Crisis Debate Jam about crisis care shouldn't come in a police car. We will have the Pro by Sabrina Taylor and the Con from Dr. Jen Stuber. So just look ahead and place that on your schedules, because it is coming very soon. Next slide. This is a reminder to all of you that there is no Crisis Jam, or there will be no Crisis Jam next week, as a preface before the Thanksgiving holiday. But next slide, following this, we are going to be honored to have our episode number 153 with the Youth Power Project, featuring Sanvi Aurora, and really want to be part of this, because again, as you have indicated to us, all of the data that is showing when people really have been watching these crisis jams at a high level, it has been when there's been discussions about youth and young adults. So we ask you in the next 2 weeks, keep this on your schedule and be a part of it along with us. So I think that is pretty much it for today. I want to thank you all. I want to thank our speakers. I want to thank Aurora, and I want to thank Shelby. I want to also thank our speaker, Colbie, for really bringing this highly charged topic up to the forefront so that we could all learn from the efforts that are ongoing. So to all of you, have a pleasant rest of your day. We look forward to connecting with you in the next 2 weeks.